Welcome to the AETCM, the emergency medicine channel. Today in this video we will be discussing about adrenaline dilutions and its uses and the preparation of adrenaline dilutions, and also we will discuss in the video how to start an adrenaline infusion and how to dilute the adrenaline. So here when we are seeing these strange numbers, we have to make sure we have to know about this ratio. This 1 refers here 1 gram, and then this 1000 refers 1000 ml. So it means 1 gram of adrenaline is diluted in 1000 ml of the solution. So normally the availability of the adrenaline in the hospital setting, it will be in the ampule. In the ampule it will be having 1 ml. So usually 1 ml, and then the concentration will be 1 in 1000 dilution. Here 1 refers the 1 gram, 1000 refers the 1000 ml. If you make it further breakdown, here 1 gram we can write it as 1000 milligrams, which will be present in 1000 ml, or else simply we can break it down and we can write to 1 ml, which will be present in 1 mg. Here total 1:1000, nothing but 1 mg in each ml. So coming to now we discuss 1 in 1000 dilution. Now coming to the 1:10,000 dilution, similarly 1 gram of adrenaline is diluted in 10,000 ml of the solution. Here 1 gram we wrote it as 1000 mg, which is present in the 10,000 ml, or 1 milligram which will be present in 1 ml. So it will comes as 0.1 mg 1 ml. If it is 1 in 1000 dilution, it will be having 1000 mg in 1000 ml. Now each mg in each ml. This is 1:1000 ratio. In 1:1000 dilution, each ml will be having 1 mg, whereas coming to the 1:10,000 dilution, each mg will be present in 10 ml, or else 0.1 mg in each ml, whereas in 1:1000 dilution 1 mg will be having in 1 ml, whereas in the 10,000 dilution 1 ml will be having 0.1 mg. Next, coming to the few common dilutions and then uses. Here the most commonly we will use it in a clinical setting, in the emergency as well. These are 1:1000 dilution and 1:10,000 dilution. So already we discussed in 1:1000 dilution, it means 1 ml having a 1 mg of adrenaline, and coming to 1:10,000 dilution, each ml will be having 0.1 mg. So this 1 in 1000 dilution, which we will given in the IM, mostly in the anaphylaxis, and coming to the 1:10,000 dilution, we have to give in the IV, which will prevent for the extravasation. Next is, and then rest of the higher dilutions like 1:80,000 and 1:1 lakh, 1:2 lakh, and 1:4 lakhs, which we will use in the surgeries, mostly in the minor surgeries, which will help to reduce the bleeding. So coming to this 1:80,000 dilution, here each ml will be having 0.0125 mg, whereas in 1:1 lakh dilution, each ml will be having 0.01 mg. So here 1:80,000, mostly we will use it as a local anesthetic in ENT. All these higher dilutions, which we will use this adrenaline with the mixing of the mixture of lignocaine, which is called as local anesthetic. This 1:80,000 we will use in the ENT, and whereas 1:1 lakh we will use it in the minor surgeries, and 1:2 lakh and 1:4 lakhs we will use it in the microvascular and as well as in the plastic surgeries. Next, coming to the how to prepare the each dilution. So the normal availability already we discussed, 1 ml 1 in 1000 dilution, 1:1000 dilution, which means 1 ml will be having a 1 mg. So 1:1000 dilution means 1 ml 1 mg. So here to prepare a 1:10,000 dilution, we have to mix this 1 mg 1 ml of adrenaline with the 9 ml of NS, and then we have to make it dilute. So when you added plus 9 ml of NS, total it will be having 10 ml. So now 1 ml 1 mg in 10 ml. Now 1 mg in 10 ml. Now this ratio similarly we broke it down in the seconds line. So here 1000 so we have seen here 1 mg equal to 10 ml. Next here we have to know about each ml consists of how much ml. So each ml consists of 0.1 mg. So this is called as 1:10,000 dilution. So to prepare a 1:10,000 dilution, we have to take 1 ml of adrenaline into the syringe and then we have to dilute with the 9 ml of NS. So in the 9 ml total 10 ml, it will be having a 0.1 mg, which we will call it as 1:10,000 dilution. And coming to the 1:80,000, similarly, so here we can see these numbers. So we have to make the concentrate, we have to make it dilute with these numbers. So if we want to make it a 1:80,000 dilution, we have to mix 79 ml of the NS along with the 1 mg of adrenaline. So total it will be having 80 ml. Similarly here, to make an a 1:1 lakh dilution, we have to mix with the 99 ml of NS with 1 mg, which means 1 ml or 1 mg of adrenaline to make a 1:1 lakh dilution. Next, similarly here 199 ml of NS should be added to the 1 mg of adrenaline to make a 1:2 lakh dilution here. And then similarly the 300 ml of the NS we have to add to the 1 mg of adrenaline to make a 1:4 lakh dilution. And coming to the to start an adrenaline infusion, the normal dose we will follow is 2 to 10 mcg per minute. In case of bradyarrhythmia, when atropine is ineffective. So to start the adrenaline infusion, we have to make sure we have to follow a 3-step. The first step, we have to choose the standard dilution. So we will dilute the adrenaline, 1 mg of adrenaline as it is available, 1 mg of adrenaline, which means 1 ml of 1 in 1000 dilution. So we have to mix with the 49 ml of NS. So 1 mg equal to 1 ml plus 49 ml of NS. So total 50 ml. So 50 ml of solution is consist of 1 mg adrenaline. So now this is our total volume. The total volume is 50 ml. So the concentration wise 1 mg is present in the 50 ml. So total, if you make it further breakdown, 1 mg we will write it as 1000 mcg. 1000 mcg micrograms. Either we can write mcg or else μg here. So this 1000 mcg which will be present in the 50 ml. So now we have to know each ml consists of how much mcg. Now each ml will be having, if you did a cross multiplication, each ml will be having a 20 micrograms of adrenaline. 20 micrograms of adrenaline. So now the standard dilution was done. The total volume we dilated into the 50 ml with the NS, which will be having adding of 1 mg of adrenaline. Now the concentration wise, in the 50 ml, each ml will be having 20 micrograms of the adrenaline. Now once the dilution was done, next we have to decide the dose range. So from 2 to 10 the normal dose. So we have to either we have to decide, we have to start with the 2 or else with the 10 or else anything in between the range. So if we want to start with the 2 mcg per minute, so simply we have to multiply with the 2. So if we want to give the 2 mcg, we have to start with the 2 mcg per minute. So 2 divided by, so the normal concentration is 20 mcg in each ml. So we have to divide with the 20. So if you multiply, now we will be having a 0.1 ml in 1 minute. So or if we want to start the infusion with the 10 mcg per minute, simply we have to divide 10 divided by 20. So it will get 0.1 ml per minute. 0.5 ml per minute. Next, once the step 1 and step 2 done, for starting the infusion rate we have to convert to the hours. So, the third step is we have to convert ml per hour. In the second step we did up to the ml per minute, and then to start the infusion rate in the syringe pump we have to convert to the ml per hour. So, simply to convert this, simply we have to multiply with the 60, whatever the value we got in the ml per minute, to change minutes into the hours. So, 1 hour consists of 60 minutes, right. So, simply we have to multiply with the 60. So, 0.1 ml for 2 mcg per minute, we got the infusion rate of 0.1 ml per minute, and then to convert into the 60, to convert into the per hours, we have to multiply with the 60. Once we multiply with the 60, we will get as 6 ml per hour. Like if you want to start with the 10 mcg per minute, and then we got the infusion rate per minute is 0.5 ml per minute. So, to change into the per hour, we have to multiply with the 60. Once we multiply with the 60, we will get in a 30 ml per hour. Okay. So, to start the 2 mcg per minute infusion rate, so we have to start 6 ml per hour. Coming to the, if we want to start 2 mcg per minute, we have to start with the 30 ml per hour. So, you calculate 5 mcg per minute, calculate the infusion rate ml per minute as well as infusion rate, and then drop down in the comment box. Next is coming to the availability of the adrenaline. The common availability of adrenaline, which will be in the ampule, it will be having 1 ml, 1 in 1000 dilution, already we discussed, and next thing is 1 in 10,000 dilution, or else this is called as pre-filled syringe. So, the adrenaline itself, it will be diluted and then it will be filled in the syringe. So, we can use, and then there will be a pre-filled syringe of 1 in 1000 dilution also. In case of severe anaphylaxis, we can give the we can use for IM injections. Next is already we discussed, as we discussed, the higher dilution, it will be mixed with the local anesthesia, local anesthetic lignocaine drugs. So, here the adrenaline is diluted along with the lignocaine, the dilution is 1:80,000, and coming to the 1 lakh, the xylocaine with the adrenaline, it is 1:1 lakh dilution. And then this one we will use the most common usage of LOX 2%, lignocaine and adrenaline, which will be the dilution of 1:2 lakhs. And coming to the clinical tips and then safety. So, 1:1000 dilution mostly preferred the IM, because the vasopressors will be having a high potential of causing a necrosis, tissue necrosis. So, if there is any extravasation, it will cause a tissue necrosis. So, 1:1000 dilution we will prefer IM, whereas 1:10,000 dilution we will prefer an IV. And then as we discussed, we will use higher dilution for local anesthesia, as well as it will also helpful to reduce the bleeding. Next is avoid adrenaline in end artery areas, and next, once we started the adrenaline infusion, we have to monitor BP, heart rate and rhythm closely. Next, as we discussed, as it is having a potential tissue necrosis, if it is causing extravasation, it can lead to the tissue necrosis. So, the most preferred is central line. So, we have to make sure central line is preferred for the vasopressors. In emergency purpose, we can start this adrenaline in the peripherals, peripheral lines, peripheral IV. Next is, once we diluted all the concentration of the adrenaline, we have to make sure we have to label clearly with the drug name, and then concentration, it means each ml consists of how much of mg, and then date and time is very important. So, in this video we discussed about what are the adrenaline dilutions, and then the concentration of the each adrenaline, and then the uses, and then how to prepare an adrenaline infusion, and then infusion rate calculations, and then uses, and then safety tips. Thank you.